In this video, we're going to go over hypoglycemia versus hyperglycemia at the EMT level. So we're going to begin with what they are, the signs and symptoms, and then jump into the treatment. So normal blood sugar levels are usually between 70 and to 100 when fasting and can be up to 140 after eating. Glucose is the preferred energy for cells, especially the brain, which uses about 20% of your body's glucose. Hypoglycemia is blood sugar under 70. Your body doesn't have enough sugar to feed your brain and cells. The body freaks out and triggers the fight or flight, releasing adrenaline. Hyperglycemia is blood sugar over 180. So sugar builds up in the blood, but the body can't use it. And if sugar levels climb too high for too long, the body starts burning fat for fuel, producing ketones, which are acidic chemicals that can lead to diabetic ketoacidosis. Diabetic ketoacidosis usually happens when blood sugar is over 250. Ketones are building up and blood is becoming way too acidic. So let's go over the symptoms and why they occur for hypo and hyperglycemia. So hypoglycemia, the brain needs sugar to function and it doesn't store it. Low sugar causes brain cells to starve, which equals confusion, slurred speech, and seizures. The body releases epinephrine, and shaking, sweating, and a fast heart rate or tachycardia occurs. In hyperglycemia, glucose stays in the blood and insulin isn't working to take it out, or there is no insulin. So cells are starving despite the high sugar and the body burns fat. Fat breakdown creates ketones, which are acidic, and ketones make your blood acidic, which can turn into diabetic ketoacidosis, which causes Kussmaul respirations. So why are ketones found in the urine of a hyperglycemic patient? Your kidneys try to flush out the acid, so you pee out glucose and ketones, which equals sweet-smelling urine and dehydration. So Kussmaul respirations is when your blood becomes acidic, your body tries to fix it by blowing off CO2. CO2 is acidic, so you breathe deep and fast to get rid of the acid. That is called Kussmaul breathing. So let's go over the difference between hypoglycemia and hyperglycemia. So hypoglycemia, the onset is sudden, the skin is pale and sweaty, level of consciousness altered with seizures, heart rate tachycardic, breathing normal or shallow, and breath normal. In hyperglycemia, the onset is gradual, skin is warm and dry, level of consciousness is drowsy, slow, could be in a coma, the heart rate is variable, breathing can be deep or rapid, Kussmaul breathing, and the breath is fruity. Now let's jump into the treatment. So treating hypoglycemia. If they can talk and swallow, give oral glucose juice, candy, or glucose gel. If unconscious, IV dextrose or intramuscular glucagon if no IV available. So hyperglycemia, in the field we're going to support the airway and breathing, start an IV, check the blood sugar, monitor for Kussmaul breathing and signs of acidosis, and rapid transport to the hospital. At the hospital, they can give an IV of insulin or electrolyte correction to help bring up the fluids, especially potassium, to try to bring the sugar down. Thank you for watching. Like and subscribe.